Hey guys, it's Dr. Abraham with A Sip of Aesthetics, and I'm here with Lauren today.
Hi.
Always great to have
I
you.
know. Thanks for having me back again. What
We're
is this, like the sixth time?
yeah, fifth, sixth time. Hopefully, many more.
I know.
Perfect. So today we're gonna be talking about some surgical versus non-surgical treatments. When to choose what.
Okay. Okay, let's get right into it. So, I think that a lot of people are nowadays more leading on the non-surgical side versus the surgical side. Can you speak on that? How do you feel about plastic surgery versus non-plastic surgery versus, different treatments that we offer here? So, I don't know what your thoughts are, but
I think there's been a lot of advancement in the field, in the non-surgical field of aesthetics. There are a lot of options. There's still absolutely a place for surgical treatments. So it is important to kind of see somebody who is an expert and can kind of guide you along the way. But you do want to understand kind of what expectations you might have with the non-surgical options versus the surgical options. What downsides each one might have, and which things can be treated surgically versus non-surgically.
okay, so if somebody came in and they were interested in doing a facelift, how would you approach that?
Yeah, so if somebody's sat on a facelift, that's usually a surgical treatment, and if they are the right candidate, they might have to go that way. Sometimes people come in for just a little bit of lifting, or they want to augment what they already have.
Yes.
And these could be, potential candidates for non-surgical treatments. I think some of the differences are going to be, typically speaking, with surgery, you can see more dramatic results, but there's also a little bit more, there's obviously going to be usually more downtime with the surgical treatments. The cost is going to be much more. And sometimes people don't want that very dramatic results. Like sometimes people, they just want a little bit of an enhancement, and it's not worth it to do, surgery for that little bit of enhancement, especially when people are starting maybe a little bit younger
just gonna say.
and they want to preserve what they have. They want to do
Yes.
something that's more preventative. A lot of times we can kind of approach it non-surgically and get amazing results. And like I said, there are more treatment options right now. So we can sometimes go even a little bit more aggressively, still non-surgically with certain treatments. Like I really like the endo lift, CO2 laser, you can go pretty aggressive with. It's still going to be different than surgery, but it is something that a lot of people are now opting for because they don't want a super dramatic difference, but they want to look a little bit better, a little bit more refreshed, a little bit less tired. A lot of times these non-surgical options are going to, give you great results, but with less downtime, less pain and discomfort many times. They're going to be, obviously a lot more affordable than certain surgery. But at the same time, you can get more dramatic results with surgery. So if somebody is expecting these more dramatic results, we're not going to promise them that they're going to get these results with non-surgical options. So that's when, setting the right expectations is very important. It's the kind of client's going to have to do the ultimate decision. Am I going to go with the non-surgical treatment? And, these are the kind of results that I'm going to expect. Or do I want to go with surgery and these are the type of results that I'm going to expect?
You talked about age. So like, let's say a 35-year-old woman comes in and wants a lift and she wants all the things. Do you recommend a facelift right away? Or like, how do you feel about that? How do you feel about younger women coming in and doing plastic surgery versus starting with the non-surgical approach?
Yeah.
Because sometimes people are like stuck. They're like, I want to do this. Like, I'm just getting your opinion, but So
for sure, yeah.
What do you think about that?
With the caveat that's going to vary from person to person, but generally speaking, the younger you start, the kind of more you can start with the non-surgical options because with these, the skin sagging and a lot of that stuff, if you can start earlier before it's really advanced, you can get, better results. You can kind of preserve what you have more in the future. So that way you might not need to do surgery, as later on. So typically speaking, if you're starting earlier with a lot of these treatments, that's kind of the recommendation that we want. We want you to start earlier to be able to get the best optimal results.
Exactly. And then down the line, visit the
plastic
surgery.
Depending on how you respond to these treatments, how your face is aging, and again, how much of a change you want. But there are certain things too that we might be able to address, more proactively with these treatments. There are certain things like, for instance, like having a heavy eyelid, a lot of times the treatment for that is surgical. There aren't as many great non-surgical options. There are certain options that sometimes can be done, certain lasers or things like that to tighten the skin. But typically speaking, if somebody has a heavy eyelid, for example, that is not something, many times they're going to have to go through the surgical route. So a lot of times people will come in, thinking that they can treat a problem non-surgically, but we end up referring them to a surgical place to get that treatment because that's where we believe they're going to actually get the best results.
I know we have some clients that come in and they are it's not fixable, but the best approach would be plastic surgery, but they don't want to do plastic surgery. How do you tackle that? And how do you talk to them about, then does that make sense? Like
100%.
Because I think that we do have clients that come in, they're so sweet and wonderful, but sometimes it's just, you have to go that route.
Yeah.
How do you talk to them and how do you approach that situation?
Well, it really depends. But yes, sometimes the best approach is surgery. But hey, if surgery is not something that they want to consider because of whatever other factors, they're not a good candidate for it, then the next best thing, we can still do some of the other treatments. Again, with the understanding that we might be able to improve, let's say, 20 or 30% of what maybe surgery could have been done. Which might not be ideal, but for that client, it might be the ideal thing because, surgery is not the option. So sometimes for whatever reason, we can't go through the surgical route. So we have to do the next best thing.
Sure. So you mentioned EndoLift. What are other treatments that we do here that are non-surgical, but that have great benefits too? Yeah.
So, a lot of times when people talk about the non-surgical facelift, they're talking about combinations of, something like injectables, whether it's Botox or fillers, so that those are common treatments. Biostimulants are certain treatments that can help stimulate collagen in your skin. So these include things like platelet-rich plasma, Sculptra, Radiesse. There are also a lot of device, based treatments like RF microneedling, lasers, CO2 laser. There are radiofrequency treatment. So there are a lot of different treatments. Threads are also, a common treatment that is sometimes done to help with like lifting certain areas. The non-surgical nose job is also a very common procedure. The nose is actually a really good example because sometimes people come in with, problem with their nose and you can fix it with, or you can improve it with fillers. And sometimes you have to kind of send them to surgery for the best results. So because fillers add volume, if somebody has kind of like a curvature in their nose, but their nose still kind of like midline, it just there's like a bulge or a curvature in it. Sometimes, a lot of times, you can make that more straight with fillers. But if they have like a deviated, septum and their nose is really kind of tilted to one side or another, that is really hard to fix non-surgically. So that would be, for example, somebody where it would be like, okay, you probably, if you really want to, you kind of improve the side-to-side appearance of the nose, a lot of times you're gonna want to have to go, more surgically, versus if it's more, again, like curvature but still midline. Again, depending on the degree of it, a lot of times you are able to improve that non-surgically with a little bit of a filler, and it would be a much quicker solution. But the surgery might be a more permanent solution. But again, the downside, the side effects might be different for each. But that I think is a good example because people come in with their looking at their nose all the time and thinking, okay, can I fix that with filler? And sometimes we're like, yes, you can. And sometimes we're like, no, we have to send you out.
Well, especially the younger generation, I think too. They come in, they want to do something first before going into like the nose job area.
And sometimes they're not ready for surgery. They're like, hey, if I can fix that non-surgically, I'm down for it.
Yes.
But if I have to go through surgery, it's just not time yet because it doesn't bother me like that much, and that's completely fine.
I know what threads are, but can you, for our viewers, what is thread lifting?
Threads are usually, mainly they're PDO threads, although there are different types of threads like PLLA threads, but they are these little threads that are placed underneath the skin, and usually they have these hooks to them. And so the way we do it is we do like a little needle poke and in the skin, somewhere like in the face, if you're trying to do a little bit of lifting of the jaw walls, and then we place the threads underneath. And then we might place a few threads and then tie them together and pull them to try to give a little bit of a lift to the skin. A lot of times people also use threads to kind of lift the eyebrows a little bit. So and these threads would kind of dissolve over time. They're meant to be biodegradable, so they would dissolve in the skin. But during that time, they're meant to give a little bit of a lift. And again, if somebody's looking for small improvement, threads might be an option. Or if somebody has more saggy skin, but they're just not a candidate for surgery for whatever reason, or they don't want to do surgery and they just want something that's going to help a little bit, we might go the threads route. Somebody who has a lot of sagginess, then they might be a better candidate for surgery.
Perfect. I love that. That's good. We talked about, so that's good. So the non-surgical versus the surgical route. I think that there are a lot of options for people out there to start. And I think a med spa is great because there's so many options that you can do before you do plastic surgery. And not that plastic surgery is not a good option, but I think starting somewhere.
Yeah, I mean, you can't do surgery every day or every month, right? They're cutting into you when it comes to surgery. It can be a bit of a big deal. So even if for somebody who's doing surgery, they still a lot of times want to maintain with kind of a non-surgical procedure. But it is a bit of a big deal. So you want to make sure you also, if you're listening to this, you go somewhere you can trust. And we try to be very honest here about setting the right expectation when somebody walks in. What can we do non-surgically? And if we think the best way to go is surgery, we do refer them out to go, to a surgical place. So you do want to go, if you can't come see us, make sure you go to a place you can trust where they can be honest with you and kind of tell you what to expect. And what can be done, what can't be done non-surgically, and kind of make your decision based on that.
Yeah, that's a big deal. So, thank you so much. That was so fun.
Thanks for coming again, and hopefully we'll see you in a few more episodes.
Yeah, perfect. Thanks so much.
Thank you guys for watching. Make sure you like, subscribe, and leave us a comment, and join us next week for the next episode.
Bye.